felt like someone had just scared me all the time. It would wake me up in the middle of the night. Very, very annoying.
When I first learned about how serious my A-Fib was, and talking with my cardiologist, I asked him what my choices were. He laid it out pretty simply. I could stay on medication, I could have something potentially implantable, or I could have surgery. The surgery was new, I didn't know much about it. I was able to research the other two. I did not like the idea of being on medication for any kind of period of time.
Because I'm athletic, I do things like sailing and skiing that are pretty aggressive sports. Living a lifestyle on warfarin just didn't seem to make a lot of sense, and my cardiologist suggested Dr. Squitieri's procedure here.
Because I was diagnosed with atrial fibrillation last fall, and after taking the heart medicines and how you felt from that, and thinking about doing that long term, I was looking for an alternative.
And the type of fibrillation I had, it was very violent. It was, my heart would go like this, the veins in my neck would be popping out. I mean, it was like you were taking a ball and just throwing it against the wall.
I was told that it was in constant atrial fibrillation. It wasn't affecting me so much throughout my day, though I did have some dizzy spells, things such as that. So I thought, let me look into the surgery because I didn't want to be on Coumadin and blood thinners, things like that for the rest of my life. And I thought, if I can correct it now at a young age, I might as well do it.
The other thing that was happening is I had no energy. I was losing all of my, I couldn't even walk across the room and I would have to go sit down.
Initially I was put on some rhythm medications, and if you ever read the label on that you get from the pharmacy, you really don't want to be taking that stuff.
And so I began to feel the problem that would exist if I had to continue on warfarin for the rest of my life. It just, I couldn't even fathom doing that. So, I'm the kind of guy that likes to get things fixed quickly, get the problem solved. And the surgery sounded very promising. We were very enthusiastic about it. I did some reading about it, and it looked like the outcomes were very, very high.
I came to the hospital. Well, first I talked with my cardiologist, and he talked a little bit about pursuing a surgical alternative and suggested I go see Dr. Squitieri. And he did talk a lot about it, so just go see Dr. Squitieri. So it really came down to meeting Dr. Squitieri, hearing about the procedure, and really having a lot of confidence in the doctor to do the operation.
And I think that my take on it is that if I go to a doctor, literally my life is in his hands. So I have to completely trust him and what he tells me. And I did. And I can't say enough good things about Dr. DeMeo and his staff. They were very informative. They made sure that not only that I understood what was going on, but that my wife understood it as well.
Both pre-surgery, because you come in for the test, and everybody couldn't be nicer and really kind of walking through the steps. And then the day of surgery, you arrive at, I guess I got here about 5:30 in the morning, beat traffic or whatever. But everybody from every nurse, every support staff just took care of you, explained what they're doing, kind of held your hand, and walked you through it. And then post-surgery in the recovery area, the staff couldn't have been, obviously very qualified, but compassionate and nicer. My wife told me I actually sang to one of them, but I don't remember that.
It seemed very low invasive. Just a couple of small holes, cut. It's not like open heart surgery or anything like that. Dr. Squitieri and his staff had a pretty good reputation, being in the top docs lists and so forth. And just talking to Dr. Squitieri, I had a lot of confidence that the surgery would be successful.
I was on the operating table within 2 weeks. They did all the tests and everything. I would come up here for the tests. And he told me I'd be in the hospital for 3 to 5 days. I went home the next day.
Well, for me, I went in Friday morning, and I left the hospital on Sunday. But it was very fast. Even at the hospital, I was off the pain meds by Saturday night, and went home Sunday and felt pretty good. The first time up a flight of stairs was, I took it slow. The second time I took a little bit faster.
My wife mentioned something to me last night. She said that when she'd call in and talk to people, when she wasn't here at the hospital, she felt like she was a part of the team, in a sense, that people would just go out of their way to explain things to her and interact with her, and it made her feel very comfortable.
The nurses on the floor explained everything that they did and what was going to happen next, and you know, why they were giving me various shots or whatever they were doing at the time, and you know, why I had the tubes, and they took all that equipment out of me as quickly as they could and made me as comfortable as they could, and it really, the recovery wasn't really anything to speak of.
Felt a little beat up, like you had bronchitis or something, but within 4 or 5 weeks that was gone. It took me a while to get my strength back. My friends were very helpful with making me play golf, and in the beginning I could only play 1 or 2 holes.
And then within a few weeks after that, I just felt better. I couldn't believe how much better I felt. My overall endurance, my conditioning, I started walking with my wife, which was the recommended exercise post-surgery. And within a short time, I'd say within a few months, I was able to keep up with her on those 2-mile walks.
Saturday morning when I was alert, looking at the heart monitor and seeing normal heart rhythm, I just laid there in bed and watched the normal heart rhythm for about an hour, and then I would turn back every few minutes and go, wow, it's still there.
I knew immediately. I knew immediately. Because my heart was at peace. I don't know how to explain it any different.
I found since the surgery that I'm able to run around on the lawns a lot easier, get a lot more work done quickly and efficiently.
I have got most of my fitness back in terms of my cardio, and I am now training for the Marine Corps Marathon in October.
The most important thing is that you know that you're fixed. It's something, you just feel it. When I woke up from the surgery, it was amazing. I could actually hear my heart beating, and it was steady. And to someone who has A-Fib, to hear that or feel that and know it's over. It's finally over.
It gave me back my life. It gave me back my life.